Good afternoon, everyone. My name is Sarah Thomason, and I serve as chair of the Virginia Opioid Abatement Authority Grants Committees, and I would like to call this all virtual meeting to order. The following grant members are in attendance. We have Delegate Brianna Sewell, Tim Spencer, Senator Todd Pillion, and myself. We have a quorum. I would also like to offer a special welcome to all who have joined us virtually for this meeting, whether you are staff or visitors. So thanks for being with us. And we will move on to our first agenda, well, second agenda number, actually. It is to approve the minutes from our meeting that occurred on June 5th, 2025. Those were posted on the website for review. Do I hear a motion to approve these minutes?
So moved.
Thank you, Mr. Spencer. Do I have a second?
Second.
Thank you, Delegate Sewell. All in favor, please say aye.
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 Any opposed, nay? Okay, any abstentions? Okay, minutes have been approved. Thank you. We'll move on to agenda item number 3, which is our update from our Director of Operations, Charlie Linnicum. Charlie, over to you.
Thank you, Madam Chair. So I wanted to give a brief update on for the Grants Committee on where things stand with grant operations first. As far as the city and county awards that were approved by the Grants Committee in June of this year, all of our award packages have been completed and distributed, save a few that have some technical / administrative updates that are needed. Still finding fun things with the system that didn't occur to us because we haven't had to step through them before, but they're all minor things that need to be resolved, and those things are moving along well. We're working on tracking the acceptance of those awards and any contingency documentation that cities and counties need to send back to us. The two next steps for those for city and county awards is the carry forward true up process, which is the carry forward amount from fiscal year 24 into from fiscal year 25 into fiscal year 26 that was approved in June was based on an estimate. This process allows us to see how much did they actually end up with, and is there any adjustments that need to be made to the award. Those are due on August 18th at 11:59 p.m. through our portal. And based on feedback from the localities last year I think we had about a June 15th or 16th due date last year, that wasn't enough time for them to get everything together with all of the other things they have to do at the end of a fiscal year. So we've extended that time frame out about a month and hope that'll make it easier on them as well as on us and cause less back and forth in the process. And the other thing is all grants that are awarded have to have an annual report that looks at their financial information, their progress, their performance measures, and those types of things. Those are going to be due 10/1 this year, and the portal. And as another, because we pushed the carry forward true out a month, we pushed the annual report out a month. We also heard that a little bit more time could be used, especially on finalizing performance measures and things. So we hope that'll make a smoother process for everyone this year. It also helps staff by pushing out when we're dealing with some things so that we're not trying to do 2 or 3 major things at one time. As far as state agency awards, all of the current performance period 24-25 MOUs with the agencies have been completed and all the funds have been transferred. And we'll begin work on the 25-26 MOUs next week based on the results of the Grants Committee's actions at this meeting. And then the state agencies will also have carry forward true up report due on 10/20 and their annual report due on 11/17. Those are some slight extensions from previous years, but due to their timing not being on the same as the fiscal year, performance period for state agencies is October 1 through September 30th of each year. There wasn't as much trouble with getting everything completed. Also wanted to note that the Central Region Local Government Opioid Settlement Liaison The full-time position that the board approved in June of this year is currently posted for recruitment. And thus far, we've received about 50 some applications, and Kara's been doing a first round of screening on those. And first swath looks pretty good. It will remain open for another week or two to let additional applications come in, and then hopefully later this month we can move to start doing interviews. So I wanted to put out just for everyone to see kind of what the next 12 to 13 months or so for the grants committee looks like. And these the items that are circled in like the dark purple, those are the grants committee meetings from September of this year through September of next year, as they are currently scheduled. Could be subject to change if there's some issues that come up. The ones on November 19th of 25 and on June 4th of 26 will be happening on the same day as board meetings that are scheduled those days. But in addition, with this, if you notice on the first line item here, as mentioned during the board meeting and grants committee meeting in June, we've updated the dates for the application cycle to open on August 15th, where it normally it didn't open until October, and then to close in the middle of March, which normally didn't close till the 1st of April. This will give applicants a lot more time to get things together and to get some earlier amendments and or earlier chances to get awards within the current year. And it'll give staff a bit more time on the back end to work the applications as that they come through to put recommendations forth for your consideration. As we've grown significantly in projects over the last few years, this will be very helpful to us and give the applicants more time to be able to respond to us as we're working through things. So this will be posted out on our website on August 15th when the cycle opens. And we'll make sure that the grants committee has a copy of it for reference. So now I will move into the main subject for this grants committee meeting, which is reviewing the request for proposals responses from the agencies of the Commonwealth. So initial summary, we opened the proposal period March 17th. And we closed it May 27th, which is fairly in line around the dates that it was open and closed last year. It's a little more than our first round, and it's given the agencies more time, and we get a lot of stuff ahead of the due dates now, which is very nice for our processing. We received proposals for 43 projects in total. 30 of those are renewals of current awards, and 13 were for new projects. The requests included about 1.75 million in carry forward across the projects for the 24-25 performance period into the 25-26 performance period, and requested about almost 16 million in new funds for renewals and new projects for the performance period 25-26. We're up to 18 agencies submit proposals this year. That's the most that we've had. Not every agency that submitted a proposal has been awarded one, and not every agency has asked every year. I think we had 16 the first year, 17 last year, 18 this year, so that's slowly growing. And just as for your information, so any proposals from the executive branch agencies go through an approval process that's so that through the governor's administration, so that whatever the agencies are submitted is aligned with the governor and his priorities before they come to us for submission. If we do a reconciliation with the Secretary of Health and Human Resources office after we receive all our proposals to make sure we don't have anything for those agencies that they are not aware of and have not used. So proposals by year, we've received since our first round of state agency proposals, which opened in April of 2023 through this most recent one. We've received 109 proposals. You can see it's been climbing each year, 32, 35, 42. So we continue to get good ideas from all across the Commonwealth and all of our agencies. This next is our standard conditions for all state agency projects. Some of these are restated things from our terms and conditions, but we just try to be overt when we're reporting out so that things are easily understood. You know, any type of all the terms and conditions outlined in the request for proposals or the RFP are incorporated here as standard. Each agency has to adhere to existing practices, policies, and directives and applicable laws when they're establishing new positions. So there's only the General Assembly can authorize an increase to the agency's maximum employment level. What that really means is if they're looking for full-time positions, they have to do it with usually restricted or grant-funded MEL that they already have. And pursuant to General Assembly language that's in the budget, OAA funded efforts do not create ongoing obligations for the Commonwealth when the awards are made to state agencies. And additionally, along with that, OAA awarded funds shall not be used or connected to legislative advocacy efforts throughout the Commonwealth. Next up mentions the performance period. So these renewals and any new projects the Grants Committee approves will start on October 1st of this year and run through September 30th of next year. Any renewals, any of projects that are awarded a renewal must complete the carry forward true-up process, whether there's been any change to what they presented to us that we have today or not. Then we will work with them to execute a memorandum of agreement, which will contain an appendix with the details of each project awarded. Yeah, for new projects, unless we note that a project is specifically a one-year project as part of its terms, conditions, and contingencies, they can request up to 4 one-year renewals of a project. And then after they've kind of gone through the initial 5 years, they have to kind of completely recompete. There's not kind of an earmark of potential future year requests. Each recipient agency is responsible for planning for alternative years of funding. Should OAA funds no longer be available, or they've got to work on how to conclude and wrap up the project. Each proposal is required to include performance measures, and as part of the process, while we've been negotiating with them what we wanted to recommend, we've worked with them to try and ensure that the performance, any changes to the scope of what they originally submitted is matched in the performance measures, but it could be as we go through the award process, there's a few others that need to be done, and we will work with the agencies to do that. Recipients must agree to submit before review any public-facing materials, including online materials, videos, printed materials, advertisements, etc., to the OAA prior to finalizing the release of them. OAA may require its name, logo, and certain wording be included in these materials, indicating the project received OAA funding. And lastly, this condition was on all of our city and county awards back in June as well, but just the agency acknowledging that's going to ensure appropriate staff and partners are subscribed to and regularly reviewing the contents of the Virginia Opioid Abatement Authority News Update newsletter, as that is our primary form of broad communication with all of our awardees. And that's where things like pertinent information, guidance, and due dates and those types of things are published. Also, before I got into the details, I wanted to give a brief financial plan overview. I'm not Adam, but he put some of this together for me, so I'm going to do the best I can on this. We'll start here with the top box on the left. This is the approved state agency budget for this fiscal year, 9.4 million. Obviously, there have been no adjustments to that during the fiscal year, so that's still how much is available in that bucket. As many of you know, we also sometimes recommend funding projects out of OAA's unrestricted funds. The approved unrestricted budget for FY26 is 20.6 million, but we have, through the actions in June, we have used 7 million of those funds. The Grants Committee has allocated 7 million of those funds to city and county awards. another 3.3 to the Operation Stop projects, and then there's 3.8 that is approved as the administrative budget for the operations of the OAA. So our remaining balance as of today is 6.3 million, and that tracks. So then down to the next box here, we have a total, if you add this number and this number, we have a total of 15.7 million that could be available for funding of state agency awards. The third section down has how much is recommended by the funding type through staff's recommendations. State agency funds, we're recommending almost 9.4, 9.379,006, which is a little bit less than the budget for that funding stream. And from our unrestricted funds, we're recommending 4.675125, which is about 1.6, 1.7 million below the amount that's budgeted. So that would come to a total recommended award amount of just a little over 14 million. If the grants committee chooses to adopt the recommendations as they are currently presented today, total OAA awards would increase to 113 million over about 25 months from the first grants committee meeting that approved awards in June of 23 through today. A breakdown here of our recommendation will show how much of the funds are going to new projects versus renewals. So about 3%, 430,000 of the recommendations are for out of the state agency funding bucket is for new projects. 8.9 or 64% is coming from the renewals for state agency bucket of funding. So 67%, large majority, is still coming from the funds that are set aside for the state agencies. From the unrestricted bucket, about 3 million or 22% is set aside for new projects, and about 1.6 is set aside is recommended for renewal. So though if it's a renewal, then it's a project that was likely already awarded unrestricted funds in its earlier years. We usually go to the unrestricted funds for short-term projects, things that are pilots or are one-time projects that don't typically have a renewal or some type of ongoing cost built into them. And then lastly, I wanted to show you where the unrestricted funds would end up if these recommendations are adopted. So there's the state agency proposal amount from unrestricted that we've talked about. That's also up here. And then the city county operation stop and administration funds that are already approved. We'll put a total unrestricted use of 18.9 off of the budget of 20.6, leaves about 1.6 million still available for usage by the grants committee for awards to cities, counties, or state agencies. And now I'll move into the recommendations by for the proposals that were also submitted by all of the agencies. We'll start with the Department of Behavioral Health and Developmental Services. I would like to note the very first item up here that's listed as Recovery High School. This is a technical amendment for the 24 and 25 performance period to correctly align the project scope with where it has ended up. When the project was approved previously, there was an amendment put in based on supporting some work some money that the General Assembly had put in to establish recovery high schools in Virginia Beach and Loudoun, and that we wanted funds from here directed to support that effort. It was determined that those localities had enough from those buckets of funding to support those operations. So this project basically reverted back to its original scope, which was trying to help plan for another recovery high school. That process has been completed and identified the Stanton, Augusta, and Waynesboro area, who basically received most of these funds to conduct their own kind of internal planning process, and they are also moving forward with that. So this just aligns the scope of this back to where it belongs, so that when the project is from DVHDS is closed out after September 30th, everything is in alignment. Everything else I will present today is for the upcoming 25-26 performance period. So the substance use data analyst is up for a renewal, has a small amount of carry forward, and a, a request for new term funds. And there is a small adjustment on our recommendation from the requirement that applies some of the carry forward to their request. It was the original carry forward was supposed to be used for professional development, not all of which was able to occur the way it was intended. So we've applied some of that to the operations, and the rest of the professional development will be able to be taken care of. This I will note this position was very helpful early on. Tony's reported to you all about working on the SUDA project, Substance Use Data Analysis Platform, with VITA and the Office of Data Governance, as well as a lot of the public safety and human resources agencies. And this position was kind of key in getting a lot of data from DBHDS integrated to the platform. The next project is the Judicial Substance Use Training. So this is going into its year 3. They have developed the kind of these what they call bench books, or kind of very detailed manuals of how things connect between the behavioral health and substance use disorder world and the judicial world. And now they're working on creating, this new year, they'll be working on kind of creating some quick reference guides for the judges, as well as making sure that other court officials like Commonwealth's attorneys and defense attorneys, public defenders, guardians ad litem, and the like, that there's materials and stuff that's available for them. And then they will also be going out and conducting regional training sessions for the court officials into the early part of the next calendar year. And then last project for behavioral DBHDS is the Virginia Recovery Corps project. This will be going into its 2nd year. These funds go to DBHDS, who then has a subrecipient relationship with Virginia Recovery Corps, who we also have another project with through a different agency. And it helps identify and train and provide stipends for employment to individuals with lived and living experience that are in recovery, and helps them work on their certified peer recovery specialist certification, and gives them some different types of job experience to help them get back into the workforce. This project supports kind of their general operations outside of the additional project we have with the public defender's offices. And so right now it's slated that these $385,000 will allow Recovery Corps to pull down a much higher and significant amount of matching funds, federal matching funds, to kind of on like an 80-20 split, 80% federal to 20% OAA funds, to support up to 65 peer navigators. Any questions on Department of Behavioral Health and Developmental Services before I move to the next agency? All right, moving on. Virginia Department of Corrections submitted 3 projects. One is a renewal of their medication-assisted treatment social workers at MAT pilot institutions. This project's name will actually be updated to more appropriately reflect in new terminology that we call like SUD, or substance use disorder social workers. And so there have been 5 social workers located at DOC facilities. And not only will this project renew funding for them, but it will add another 5 locations across the Commonwealth, facilities that have a high number of people with opioid use disorder. And the social workers help through cognitive behavioral programming, case management, discharge planning, and those types of things. Thus far, the DOC has seen a lot of very good results for this, and is excited to expand this out to more of their facilities. That not only is it having a good impact on the people who are participating in the program and their outcomes, but it's even creating some like environment and kind of change amongst how people approach in the facilities, approach people with addiction issues and that type of thing. The next project is the reentry wellness kit contents. This project was not recommended for funding due to budgetary constraints within the funds that we had available to award. We wanted to be sure to bring you a balanced budget and not overspend the funds that were allocated. So this project was not selected for funding because of that. And its proposal was to expand the agency's naloxone take-home kit initiative to provide essential overdose response, harm reduction, health supplies such as naloxone medication, destruction packets, pregnancy test, wound care supplies, linkages to community resources, and other things of that nature. Then the last project that is recommended for funding, naloxone distribution for probationers. So this project is recommended for funding $169,920 to implement pilot naloxone dispensing boxes in 6 Department of Corrections probation districts: Fredericksburg, Farmville, Portsmouth, Virginia Beach, Abingdon, and Norfolk, with 2 boxes in each region of the department. They will have dispensing box will supply 2-dose naloxone kits in the boxes. And so this is for probationers who are visiting their probation officer in these facilities, and would allow them in a place that they are already going easier access to naloxone, whether or not there's a point that has to be used for themselves or for other people that they are around. Any questions on the Department of Corrections before I move to the next agency? All right. On. Department of Education submitted 2 projects. First project is the renewal of their opioid abatement education plan. And this is a project in which they coordinate with OAA as well as 3 other state agencies that are providing different components of youth prevention and education, have a great collaboration amongst those agencies. And this piece has been integral to keeping everything aligned in the schools and providing resources and support to the schools to be able to take all the information that's coming from the other agencies and get it out to the students, continue to expand year over year how many schools they are in. The other project is a new project requested of $518,700, which we have recommended coming from the unrestricted because this is a short term. This is slated to be a 3-year project. This will establish a Virginia Recovery Schools Technical Assistance Grant Program to support the development of existing recovery high schools, providing academic instruction and therapeutic services for students recovered from substance use disorders. This initiative is going to provide the existing recovery high schools with technical guidance, professional development, financial resources through an RFP process necessarily to help them implement and sustain the recovery schools across the Commonwealth. So this does not set up additional recovery schools. This is really just allowing those recovery schools that are in operation and or soon will be to have a technical support arm through the Department of Education to help them with their operations and figure out what they need to do to be successful long term. Any questions on Department of Education? Next slide. All right, Virginia Department of Health. Virginia Department of Health has been, I believe, since we've started and continues to be, has the most projects submitted to us and has been our largest awardee. So we have a couple of slides to get through to cover their projects. The first is their comprehensive harm reduction project. So this is a renewal and is carrying forward a little bit of funding. And it allows them to continue to expand the number of comprehensive harm reduction sites from 10 to hopefully up to 19 by 2028, providing the various services and linkages to care that those sites do. This project has continued to move along fairly well. The next and any type, as with any of our harm reduction projects that are awarded, the agency is required to ensure that all harm reduction efforts are in full compliance with FDA guidelines, state law, VDH regulations, all kind of applicable laws and regulations. This is not a free check to kind of go outside the lines. Next project, naloxone distribution program infrastructure. So this project is going into its third year. The VDH, through their pharmacy and working with their IT staff, have set up a number of portals where different audiences can apply to receive naloxone, including individuals, and some of it through a no-cost process. And so this has been being renewed for another year to provide support for some contractors who are helping facilitate the requests as they are coming through. The next is also a renewal for local opioid use disorder coordinators. This is also going into its third year. This is funding opioid use disorder coordinator positions at the Richmond Henrico Health District, the Hampton Peninsula Health District, and the Portsmouth Health District, which were three of the highest areas with the highest opioid overdose death issues. All three of those areas also received Operation Stop grants as well, through the cities and counties and individually. So this basically takes all the disparate things that were sitting in the health districts that supported opioid use disorder people and puts them under one person so things can be properly coordinated, resourced, and more efficient services provided. The next is naloxone purchase. So this is another renewal going into year 3. However, the request was originally for $1 million, and we've put this over as $500,000 from unrestricted because we're setting up a requirement that the agency must demonstrate. It's in the contingencies here at the bottom. The agency must demonstrate the expenditure and/or encumbrance of all other funds they have to purchase naloxone before using OAA funding as a last resort. So they will have to show us that all of the other funding resources that they have, that VDH has to purchase naloxone, have been either expended or encumbered before we will transfer these funds to be spent to purchase naloxone this year. That way there's not an award that is made out if the funds are ultimately not needed based on the resources that they currently have. Next VDH project. Overdose prevention strategist in the West Piedmont Health District. This is a renewal going into year 2. West Piedmont Health District is the Martinsville, Henry County, Franklin County, Patrick County area of the state. And this position is working on population-based overdose prevention efforts, navigating resource mapping, development of referrals, things like that. It allows someone to kind of full-time focus their efforts on this for this area, who is not heavily resourced in opioid use disorder services, and we are now have some grants with their localities, and one of which will actually coordinate with this position around harm reduction work in that area. Coordinating local and regional overdose review teams. This is also a renewal into year 2. Helps support the continuation of standardized approach for local and regional overdose review teams throughout the state. Then the next project is a harm reduction for pregnant women pilot project. So this came in at 6/31/430. We're recommending this out of unrestricted because it is a pilot project, so short term. This is going to target women who are pregnant, currently using drugs, particularly opioids, as well as women of childbearing age who may not be pregnant, and will help them understand, help them understand whether they are or aren't pregnant, need for contraceptives, pending negative pregnancy results, and partner with various resources to provide services for them. And basically, this came from data that has shown that a large number of women of childbearing age were treated at a hospital for an overdose. And also in that same period, a number of them were positive for opioid use during pregnancy. And there were a number of hospitalizations related to neonatal abstinence syndrome, which is kind of, in addition to the health of the mother, we're worried about the health of the baby. And so this project will help push resources specifically to those who might be pregnant and using or potentially pregnant and potentially using, and try to get resources to them to help have the best health outcomes for the mother and the baby. Then the last two projects were not recommended, again, due to due to our budgetary constraints of bringing you a balanced budget. The first is the state adaptation of pregnancy and substance use. It should say a harm reduction toolkit there. One of the words got cut off. This was a project proposed for development of a Virginia version of this harm reduction toolkit that already exists in partnership with the Academy of Perinatal Harm and Reduction, Perinatal Harm Reduction. And so funding was requested to kind of adapt that to Virginia. One of the main reasons that it was not funded is as we were choosing, we felt putting funds in the previous project that I mentioned, this pilot project of harm reduction, was a better use of funds than this potential toolkit. Plus, the cost was not that high. There's very likely other ways the agency might be able to fund that project if they were so inclined. And the last is an expansion of emergency discharge data. So that was not recommended due to the budgetary constraints. It was proposed to update outpatient patient level data set, or PLD, to include data from emergency departments and outpatient procedures and surgeries in an effort to improve the understanding of public health conditions. It would all go into there's a platform that puts all this information together and helps identify issues and trends and be able to set up responses to emerging issues. Another reason that this was not recommended for funded is it looked like potentially it's collecting a lot of things, which opioid data is one of those things, and it was hard to determine whether or not how much of this was actually funding collection of like opioid and substance use disorder data versus a much larger swath of data. So did not feel like it was the right use of those funds because the opioid piece was only a part of the project. Anyway, as to finalize all of that, total of $3.2 million for recommended for the Virginia Department of Health. Any questions on this agency before I move forward? All right, that was the longest one, promise. Next, we have the Department of Health Professions, a renewal going into year 3. These funds help support the prescription monitoring program. The agency has continued to improve and also help providers integrate the prescription monitoring program into their own electronic health records and pharmacy dispensing systems. And it helps the PMP project defer pulling down on some funds that it has until a later date, as some federal money has ended for this project. So this one is an easy PM supporting prescription monitoring program is a usage that's supported directly in Exhibit E. And then we have the Department of Medical Assistance Services. This is their discharge bridge program, also moving into year 3. If you'll note, the amount of carry forward is 75, and then the amount recommended for the new year is 975. There's 150,000 a year that supports the technical assistance and creation of this bridge program, which is basically as people are discharged from the emergency room, getting them provided to connections to support and care, treatment, and recovery outside of the emergency room. Sometimes that's one of the most captive chances, and a doctor has a chance to make a connection with someone, and it's kind of like a warm handoff. You may have heard the term. And so they've been building a technical assistance, providing a lot of webinars and training to get hospitals interested in this. And this 900,000 that we've recommended coming from unrestricted will support like one-time grant awards to hospitals to be able to set up these programs. And it is the expectation that once the programs are set up, they will be maintained and continued in a self-sufficient manner by the hospital. This just provides capacity building. And I believe this it's about the grants, sub-grants are about 300,000 apiece. So this would support 3 hospitals in this upcoming year that apply for the project. Any questions on health professions or Department of Medical Assistance Services before we move forward? Right. Department of Social Services. First project is a renewal of the Kinship Care Navigators project. This is also going into year 3, helping providing concrete supports for people who are in a kinship care relationship with children that have been separated from their parents due to substance use disorder issues. This being direct kin, such as brothers, sisters, aunts, uncles, are quite often grandparents. Also fictive kin as like close identified friends of family and things like that. During the 24-25 performance period, social services partnered with a vendor to conduct a comprehensive community landscape assessment to evaluate the readiness, the opportunities and pathways of expanding the program across the state and partnering with localities that had identified needs and gaps in services. And DSS will be working with the state DSS will be working with local departments of social services to help provide funding to them to expand these opportunities. This is a great program that we have with DSS. As many of you may know, children who enter the foster care system because of being separated from parents with substance use disorder at a hugely high percentage chance of developing substance use disorders themselves. Those that enter kinship care have a much better outcome later in life if they are reunited with their parents, or even if the kinship care becomes a more permanent situation. The other project is going to year 2, which is the updates of the 211 opioid reduction registry, integrating an opioid reduction registry into Virginia's 211 information and referral service. And we also have them working and coordinating with the 988 system. And so what this does is to ensure that the 211 Virginia Resource Database for individuals dealing with substance use disorder is continues to be expanded, and make sure that any new services that are added are entered and properly updated. So when someone needs that assistance, they have the most updated information available. Any questions on social services? Right. On the home stretch. George Mason University, this is one of the newer, actually this is their first year submitting a project for proposal to us. So they have submitted for a bridge MOUD, medication for opioid use disorder warm line project, recommending 200,000 to do this as a pilot. It's going to be developed through regional partnerships and tailored to community infrastructure building, and serve as a centralized data-driven initiative to expand access to evidence-based treatment and recovery services for individuals. So when someone in the Northern Virginia area where George Mason is located, their hub will scale this services through connections with emergency departments, emergency medical services, and criminal justice partners. If this is successful, then they will seek additional funding in year 2 for other areas of the state, including Richmond, Chesterfield, and Central Virginia. And the agency is going to acknowledge that this is a one-year pilot project, and the performance of the agency will impact OAA's decision in renewing and or potentially increasing funds in future years. Oops, sorry about that. We also have on this slide the Office of the Attorney General for the Opioid and Fentanyl Prevention and Awareness Campaign. A request of $500,000. So this has been one of the probably easiest to implement projects from the OAA side, as the OAG has a lot of resources around doing these types of campaigns. This continues the focus on fentanyl with One Pill Can Kill, Get Smart About Drugs from the DEA, and sending people to the Virginia Rules site. For last year, the OAG's this program had some funds set aside to do a coaches versus overdoses program, treating for that was targeting high school, college, and university athletes. The program went well, but they don't feel a need to continue to have a full relationship with that organization to continue. But if they have playbooks available, they will distribute those. Is also work with student athletes that's done through the Department of Education and their project that OAA is currently funding. Any questions on George Mason or the Attorney General's office? All right. Office of the Executive Secretary of the Supreme Court of Virginia, two projects. The first is the continuation of the statewide universal drug testing process. So this is the Office of the Executive Secretary is providing subgrants to agencies to implement a statewide best practices standard for drug testing within all alternative dockets. So these funds help the agency set up the process and be able to assess the results that it provides for their courts and their communities. And so that in the long run, the localities will have to fund that on their own, though the city and county's own abatement funds would be usable for that as well. And so they provide some of the technical assistance as well for this. So that's a year 3 renewal for a total for a new year funds of 500 and a carry forward of 63,000. And then the second project is what's called the GAIN SS tool project. It was not recommended for funding. It was a small amount of funds to implement a global appraisal of individual needs short screener assessment program that would have been used throughout Virginia special dockets to better identify and serve individuals. This was a low cost item, and as we were cutting funds to bring a balanced budget, not sure why this type of low cost funding wouldn't be able to be absorbed by the agency itself. And additionally, this project seemed to have a very broad scope potentially, and we had concerns about how much of the things collected would be related to substance use disorder and opioid use disorder versus other things that might pop up in this area that maybe don't meet the abatement definition. Any questions on the Supreme Court? Okay. Radford University going into year 3 for their Project Hope, which is their collegiate recovery program. They have a lot of elements to this program, and they also partner with the local grant that we have that's called the New River Valley Recovery Ecosystem that's headed up by Montgomery County. They have established a 4-bedroom suite of university-owned apartments for individuals that are in recovery to help them have additional support throughout the year. And they have done a number of events that involve the Radford community, a lot of work with their Greek organizations to get training to the fraternity and sorority members and have naloxone available in their facilities and those types of things. And then our other new agency for this year is the University of Mary Washington, who is looking for some funds to help expand their Eagles in Recovery collegiate recovery program. So, and this applies to students who identify as being in recovery, are exploring recovery, and also are affected by substance use of a family member or close friend, and or those who just wish to learn more about this, about substance use and recovery. And also welcomes individuals to support peers and contribute to more informed and inclusive campus community. The main thing this will fund is a health and well-being student intern who's going to be developing and who will develop and share health-related messaging using social media and other outreach tools. They'll promote wellness, increasing awareness of on-campus resources, and support efforts related to health education, risk reduction, and self-care. So this will help them kind of get the message out more, provide more data-driven outreach, and be able to support more students. Any questions on Radford or Mary Washington? University of Virginia, renewal of 2 projects. The first is the Cosmos project, community outreach and support for management of SUD. So this is a pilot program for digital contingency management. They are working with a vendor and who provides the platform so that they can see how this program might work in Virginia. And it is a 2-year program, but there were some delays getting the initial contract with the vendor executed. That has been done. They are started and moving, which is why I do see they have some funds spent. So we will work on them to figure out what the exact time frame of the 2-year pilot project will be based on action of the grants committee today. But this at most would probably have 1 additional renewal to get through that time frame, and then it will be done. So it's the funds for renewal have been recommended to come from the unrestricted bucket of funding. The other is the street medicine reduction and treatment, or the SMART clinic. This is a street medicine kind of focused clinic that is run by UVA. It's basically an office-based opioid treatment program, but it's based in a multi-resource day shelter known as the Haven. So it's allowing UVA's program to reach people where they are and be able to help them address and get treatment for substance use disorder issues while they're in an area to also get other things. They are working on this has expanded their helpline, and they are working on deploying harm reduction supplies through a vending machine. This has taken a little while to get off the ground as they worked with Charlottesville to find a location. They have done that, and they are moving forward with that. I expect that to be executed sometime this fall, and any of their harm reduction program has to, again, be in compliance with FDA, VDH guidelines. And there's a small expansion of the project to had some additional hands-on support for individualized focused in supporting recovery. Another thing with their harm reduction stuff, because the vending machine ran into some issues, is before they can finally deploy this, they have to present their plan to the OAA staff for review to ensure what they're doing is compliant with the terms of the grant. Any questions on UVA? All right, Virginia Commonwealth University. This is our other multi-slide one, but we're almost here at the end. The first is the Virginia Opioid Toolkit Project. This is something we've been working with VC on since the beginning, that goes and identifies evidence-based opioid abatement projects across the Commonwealth and kind of reviews their evidence-based information and then adds them to an online toolkit that people can access to figure out if they want to, if there's a project they're looking at, who else is doing this in the Commonwealth and doing it in an evidence-based way that seems to work pretty well. It allows people to make contact on these types of things outside of just directly calling the OAA. And that is a straight renewal and has been a good partnership for OAA. Second project is the Massey Cancer at VCU project. This is looking and researching to develop protocols for pain management in palliative care settings. For this, because of an increasing problem of patients surviving cancer, but then having opioid dependence. The project is continuing. It's kind of a slow, they're blazing new trails here. There's not much that exists on this. So trying to make sure that they can cover all the bases and whatnot, but they continue to make good progress on the development here. The next is the Virginia Naloxone project that's going into year 2. It's a multi-phased effort to decrease overdose deaths, reduce stigma in healthcare settings, and propagate the dispensing of naloxone to at-risk emergency department patients across the Commonwealth. Also had some good results. They're working collaboratively with Virginia Tech Carilion School of Medicine and a national nonprofit called the Naloxone Project to leverage experiences and partnerships across the Commonwealth. Also going into year 2 as a renewal is the Fast Track Certified Substance Abuse Counselor project. So this helps people that are preparing for their bachelor's of social work and for their master's of social work students to be able to achieve a certified substance abuse counselor certification as through their coursework. So by the time that they graduate, they would also have that certification to go along with it. Next is the Ramsden Recovery Scholars. This is also going into year 2, supporting the expansion of VCU's Recovery Scholars program, which is actually the flagship initiative of Ramsden Recovery, and it's also Virginia's largest collegiate recovery program. It also has a national grant that it has used to help set up other collegiate and support other collegiate recovery programs across the Commonwealth. And so this continues. This primarily is funding scholarships, and they have funded this. They have funded 220 scholarships that they project to by the end of this performance period, and this will help them increase to 240,000. They also had there's a slight increase in their operational costs from the OAA request, but they brought in a significantly higher matching funds that's probably covering 80 to 90% of the overall funding increase. So nice to see when they ask for more funds, they also bring more with them. The next project is, or actually, I guess the last one for VCU, innovating digital tools to foster a culture of health for individuals with opioid use disorder. And this is a project that was not recommended for funding due to budgetary constraints. It was proposed to develop and implement a machine learning driven social media campaign to reduce opioid use and overdoses, supporting individuals with opioid use disorder, educating the public. Any questions on VCU? Okay. Virginia Cooperative Extension through Virginia Tech. First project going into year 3 is their opioid use disorder. Would call them probably prevention navigators. They're working throughout the Commonwealth and working to put in things in place like Botman life skills, adverse childhood experiences in schools, and also work with regional substance use education and prevention coalitions. They do a lot of training the teachers and providing them with the resources to be able to teach these programs in their schools. So they're a nice complement to the DOE project, and they are part of that collaborative I mentioned, along with the Office of the Attorney General and the Virginia Foundation for Healthy Youth. This started off, this most extension agent work is often considered rural, and the initial parts of this project before it came to OAA for expansion funding was rural. We challenged them to and asked them that they needed them to expand into urban areas as well, and they have done so. I mentioned in the last call that I was on that they had gotten even into Portsmouth schools, so they're working all across the Commonwealth. The second project is new. This is support for expansion of Virginia Tech's recovery community, help them reduce barriers for students recovering from addiction, getting evidence-based and evidence-informed support in the collegiate environment, and help build a recovery integrated campus. So there's outreach, trying to provide more resources, housing scholarships, expand recovery seminars and recovery programming to the targeted population of students. Any questions on Virginia Cooperative Extension Virginia Tech projects? I think we only got 2 left. Virginia Foundation for Healthy Youth. So these projects are both listed as new because the earlier version of these projects were only given a short 2-year duration. Because of the cost of them, but also because of the reach and the initial funding coming in part because there was no amendments to the budget made, the state budget made when we awarded our first round of grants that would have helped provide some resources for this. So this would be them going into a phase 3 of their deadly dose statewide fentanyl overdose mapping campaign. Healthy Youth has been a great partner in this. They have lots of data to drive where they're going. They put together, new types of interventions and outreaches around this, focusing on youth and dealing with accidental fentanyl poisoning and especially with high school students as well as other young adults. And it's a multifaceted outreach campaign. And then the other is expanding access to the dangers of fentanyl lessons. This was initially developed for high school students. Last year, it was expanded and adapted to also be available for middle school students. And this is continuing support of that project to keep information up to date and coordinated with other efforts that come out and continue to adapt to make sure that resources are available for the teachers to use this as well. And so both of these projects are recommended from unrestricted because they're one time. Once these media campaigns are usually done, they change a bit and move into something new, as well as developing of these prevention programs. So one time, short term, recommended from unrestricted. Questions on Healthy Youth? All right. Virginia Indigent Defense Commission, Reentry and Recovery Specialist Program. This is where Indigent Defense is partnering with Recovery Corps. Maybe I remember I mentioned what feels like a long time ago now with DBHCS. This is a separate project from that that helps. They partner with Recovery Corps to put kind of peer navigators in public defenders' offices across the state to help provide resources to the clients, to the public defenders that have kind of substance use disorder related charges, and help them with things like case management and working on alternative sentencing guidelines. And I should say not guidelines, being able to understand and work through and request alternative sentencing processes. And this is a unique project in most of these types of positions often are on the prosecution side, like a Commonwealth's attorney type of side. And this is one of the few that I know of. I've talked to people about this nationwide that's actually sitting on the defense side. So this is going to they're gonna have people placed in Chesapeake, Chesterfield, Danville, Fredericksburg, Halifax, Hampton, Lynchburg, Martinsville, Newport News, Norfolk, Portsmouth, Pulaski, Suffolk, and Winchester. Throughout the year, there's a number of them, I believe 9 that are ready to go right now. And if there was an issue placing anyone in some of these spots, whether applications or candidate doesn't work out, they have the ability to move to Bedford and Smithfield as alternative sites. There's also an amendment to this project to add another partnership for a client advocate position through a nonprofit called Partners for Justice that trains non-attorney advocates to assist clients with case management and access to services. That position will be placed in Richmond. Indigent Defense already has a relationship with them outside of the OAA project for 2 positions that are in Chesterfield and have had good results and have had trouble finding the right person to fit with the kind of complex needs that the Richmond community has around this. And so as we continue with this, ultimately as a pilot project that will come out with a report at the end that kind of assesses what are the best models in which situations to apply these types of resources to communities. This is just kind of another part of it, and we'll see how that works out. But along with that, when you engage with Partners for Justice, you have to have two positions in a locality, and Indigent Defense is committed to funding one of those positions themselves. And if this amendment is approved, to to add the other one. And I can say, as the person who's normally coordinating this, this has been a collaborative project that continues to develop itself as we run into issues and barriers, and both Indigent Defense and Recovery Corps have been very easy to work with partners to try to keep everyone swimming towards the same line. Questions on Indigent Defense? All right. Last and certainly not least, Virginia State University. 3 projects there. The 24-25 period was their first period. There was some delays getting some of the administrative things finished. And so they didn't spend as much as they had hoped, but they did get some money spent and are having some results, but also have some carry forward. So the first is the healthful engagement for support, treatment, and recovery and intervention going into year 2. Helps improves access to substance use disorder treatment and recovery services for adults. VSU's offering individual and group support sessions, as well as other therapies for addiction recovery. And through especially this project, as well as others, they do a lot of coordination and collaboration with the District 19 Community Service Board, who's also a provider of these services in this area. Leveraging workforce needs. This project is it's educating and preparing certified peer recovery specialists and substance abuse counselors and drug and alcohol counselors for work with this kind of very vulnerable population, and also trying to provide connections for people to work in these fields. And then lastly, mobilization of access for underserved and marginalized communities. This allows Virginia State to identify and address needs and disparities with access to abatement efforts for individuals in traditionally disadvantaged communities, identifying stigmas with treatment recovery programs, how to increase engagement, and how to evaluate evidence-based programs. So just because something works well in Southwest Virginia doesn't mean that it would work in downtown Richmond, and vice versa. Different populations, different people, different physical barriers, different community barriers, different stigmas, all kinds of things that go in. And so they're looking at programs, both ways to figure out how these things can be potentially be adjusted and improved to work well for all populations. Any questions on Virginia State? Okay. Next steps, the next grants committee meeting will be Thursday, September 26th at 2 p.m. in Farmville at the Prince Edward Rescue Squad building, where we've had a couple of meetings before, fairly easy to access and whatnot. This will likely mainly be focused on amendments to state agency or city and county awards, and might have a few new individual distribution awards for cities and counties that didn't quite have everything ready for to be in place for the June meeting. And with that, Madam Chair, I turn it back over to you.
Thank you so much, Mr. Linnicum, for your review of all the proposals and discussion of the recommendations. And I speak on behalf of myself, and I think the rest of the grants committee, our appreciation to you and the rest of the staff for those comprehensive reviews of all the applications and your attention to providing us with a balanced budget. So just wanted to tell you that before we moved on. Next in the agenda is the time where members of the public may address comments to the Grants Committee. We do request that all comments be kept to 3 minutes or less. If you would like to speak, please click the raise hand button on your screen, and our staff moderator will call your name and enable you to speak. We'll do that one at a time. So we'll go ahead and let anyone that would like to speak hit the raise hand button. Do we have anybody that's raised their hand?
No, Matt's coordinating the technology for us today and has not seen any hands raised.
Okay, we will move on to agenda item number 5, which is our new business. The first item under new business for our grants committee is to consider the awards that were listed on attachment A to our agenda for amendments to the current year awards for our state agencies as recommended for approval by staff. Again, that's in attachment A. And Mr. Linnicum just described in his presentation. Those are for the performance period of 2024 to 2025. So I will now entertain a motion to approve the block of awards consistent with our staff awards and their staff recommendations. Do I have a motion?
So moved as presented.
Thank you. Do I have a second?
Second.
Thank you very much. All in favor of the motion, please say aye.
Aye.
Aye. Any opposed, say nay. Any abstentions? The motion is passed unanimously. We will move on to our next item under new business, 6B. Again, this is listed on attachment A for renewals, amendments, and/or new project awards as recommended for approval by staff in attachment A and described in our presentation for state agencies for the 2025-26 performance period. I'll now entertain a motion to approve these blocks of awards consistent with our staff recommendations. Do I hear a motion?
So moved to approve.
Thank you very much. Do I have
Second.
a second? Thank you, Delegate Sewell. All in favor, please say aye.
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 Any opposed? Nay. Okay, any abstentions? Okay, we have approval unanimously for that motion.
And Madam Chair,
Yes?
just for the purpose of the public, just to let them know that we aren't just hearing this for the first time and then voting. Staff does an excellent job of giving us a package ahead of time so that we've had the opportunity to review that package prior to Mr. Linticum's presentation.
Yes, thanks for letting that know. They do an excellent job at preparing us and helping us look through all of those proposals and the whys and for the recommendations that they make. So thank you again for reiterating that. I'll now entertain any other items of new business or motions from the members of the Grants Committee. Not hearing any, I will also ask if any members of the committee would like to make any comments. I think Mr. Spencer's comment was perfect.
Madam Chair, if I may say thank you, Mr. Spencer. We'll make notes to make that clear during my presentation in the future, because not everyone sees everything that you all see. And if anyone is interested to review that document, it is available also on OAA's website under the grants info page, the last tab at the bottom. And also, if you go to the Commonwealth calendar where the information for this meeting was, it is attached to the agenda.
Yes, I am very proud of OAA and our transparency. I mean, everything you need to find is on our website. So I do encourage anybody to go there and do the reading, and you'll be able to find it all. Okay, not hearing any other comments or discussion, I will entertain a motion to adjourn our grants meeting at this time.
Motion to adjourn.
Second.
Thank you very much. All in favor, please say aye.
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 I think
May
that's
the weekend
everyone.
begin.
What'd you say?
And may the weekend begin.
Yes, it is. It is the weekend. I hope you guys all have a great one, and I look forward to seeing you for our next meeting in September.
Thank you.
Bye.